much. Good morning, ladies and gentlemen. First of all, please allow me to sincerely thank the host, the Irish Cancer Society, for organizing this excellent event and bringing us all together to discuss today's very important topic of tobacco control in the wider context of our policy against cancer. Let me start by placing what we are doing on tobacco in the overall context of our work on cancer, and if you allow me to say a few words about that before I move on to the Tobacco Directive. The basic premise of our action against cancer must be to take stock of the fact that 1/3 of all cancers, fully 1/3, can be prevented, either by modifying or avoiding key risk factors. And we know what these risk factors are. Smoking certainly is key. Overweight, low intake of fruits and vegetables, low levels of physical activity, consumption of alcohol, and combinations of all of this especially. So clearly, we have to start from the point of departure should be that we need to work strongly on prevention. We must also, both individually and collectively, take every opportunity to help people help themselves by discouraging unhealthy lifestyles, but also by promoting good habits. It is true, it's a matter of personal choice at the end of the day. But personal choice does not happen in a vacuum. It happens in a social context. And we need to provide every possible incentive, every possible assistance to people to enable them to make the right choice. The right choice should be the easy choice. Unfortunately, very often it is a difficult choice for various reasons. So I'm very convinced that this event and the European Week Against Cancer that we hold on an annual basis provides an excellent opportunity to continue to raise awareness on cancer prevention. There is a big risk in these troubled times that every new problem pushes the old issues off the radar screen, but those problems are still there and they're also contributing to the general problem, for example, of unsustainability of our health systems. So we need to keep the political attention very strong on issues such as cancer prevention, and also to keep up the momentum. A lot of good work has been done, more needs to be done, and we need to build on what we have managed to do so far. The European Commission has a long history in the fight against cancer. Going back to 1985, this has been a priority in EU public health policy, and the first European Action Plan against cancer, which was adopted for the period between 1987 and 1989, and the subsequent fight against cancer has been an important, one of the main objectives in European Union health programs from the 90s until now, and will remain so, I can assure you. These first plans against cancer strongly stimulated a lot of specific further work. We had the first European Code against cancer, the first directives on tobacco, and the Council recommendation of December 2003 on cancer screening. And today we are moving to a phase where we are trying to be more practical. We are trying to assist member states by developing the tools, for example, to assist them in implementing their cancer screening programs. We are looking at things like a European voluntary accreditation scheme, for example, for breast cancer services, and a lot of other practical initiatives. So the emphasis in the coming years will be on practical measures that can assist the member states to implement these policies. And also, as we say, to put our money where our mouth is, and we are also investing over 180 million euros a year in cancer research, and we are constructing a cancer information system for the whole of the EU, again to provide infrastructure to assist the member states. But let me now turn to the issue of tobacco, because, as I said in my introduction, prevention is the most important thing we can do. And prevention means we need to tackle known risk factors, and top of that list of known risk factors is tobacco. This is a proven fact, yet still we have unacceptably high levels of tobacco consumption across Europe, which varies widely. We have member states which are in the high 30s, even 40% of smokers. Others in a bit better position, but certainly we are far away from the low levels in places like Australia, New Zealand, Canada, which are below 20%. The state of California, 12%. So clearly, we have these are the kind of levels we want to aim towards. We are not satisfied with the fact that we have 28% average in the EU of smokers, even though the level has gone down, at least for some sectors of the population. We see some worrying trends, some of which you mentioned in your introduction, the issue of female smokers, where in many countries the rates are actually going up, and we could be facing some very serious not only health problems in the future, but also social problems. Because unfortunately, women are still disproportionately represented in the disadvantaged socioeconomic groups. And we now have yet another burden on this group. Apart from the effects of the economic and financial crisis, we could face a real health crisis in this group as well. And the problem with health crisis and health effects is that even after the worst of the crisis, economic crisis, is over, we could end up with a delayed and persistent effect even when we do have an extent of recovery. So the Commission accepts all this and has realized that to tackle these problems, we can't just leave it to people. We need to show political leadership. And this is why the Commission took the decision last year to revise the Tobacco Products Directive. The current Tobacco Products Directive, what we have today, dates back over a decade, dates back to 2001, and a lot has happened over the past 12 years. We have a lot of new scientific knowledge about tobacco and its effects, but also about the mechanisms of addiction and the mechanisms of attractiveness. We know much more, for example, from behavioral science, the roles that pictures, images, scents, and so on can play. We have had very significant market developments. The industry has thrown down a challenge to the regulators by specifically targeting groups of people we do not want them to target. Young people, women. There are brands on the market which are blatantly aimed at these the sectors of the population. And the regulator must respond to this challenge. We cannot sit idly by and allow years of painful tobacco policy to be undermined by these clever marketing techniques, which are clearly aimed to bring in new addicts. And significantly, we have had international developments. First and foremost, the very important Framework Convention on Tobacco Control, which is the first and so far the only legally binding treaty in the area of health, an amazing take-up by so many states across the world. When I was in Seoul, in Korea, for the meeting last November of the FCTC, it was amazing to see so many countries in so many different situations speaking with such a high degree of coherence. It's very rare, I can assure you, in international audiences to speak in international fora to hear this kind of thing. But it clearly shows that there is acknowledgement that tobacco is a global problem. It's a global problem. So we have had all these developments. And the point I would like to emphasize, because this is often ignored in the discussions on tobacco, we hear a lot about a lot of international obligations, about what the WTO says and about what TRIPS and the intellectual property agreements say. These are very important. And the Commission has paid very careful attention to ensure that what it has proposed is fully compatible with these provisions. But the FCTC is not subservient to any of this. The FCTC is also a legally binding international treaty at the same level. We do not have a choice which instruments to comply with. We need to comply with all international instruments, including the FCTC. And the FCTC does not just mandate the objectives that member states and signatories need to reach in terms of tobacco control. It also looks at aspects such as, for example, how to minimize the negative impact of the industry, its lobbying techniques, so the interaction with the industry. There are some clear rules there on what needs to be followed. And we always emphasize in our discussions that all of the EU member states, without exception, all of them, and the European Union as the European Union, have signed up to the FCTC, which means we have clear legal obligations, binding legal obligations, to implement the provisions of the FCTC, whether they be on labeling, ingredients, the fight against illicit trade, the interaction with the industry, and so on. And this was a point of departure. We could hardly argue that Europe has complied with the FCTC if we haven't even, so far, updated the main instrument we have, which is the Tobacco Products Directive. That is the key legal instrument at the disposal of the European Union. Then we moved on to the second consideration. Who especially do we want to protect? The answer to that is very clear. We want to protect young people. The industry claims that they are not interested in promoting smoking among underage people. This is what they claim. The facts speak otherwise. 70% of smokers start smoking before they turn the age of 18. And 94% start before the age of 25. So it's very clear. If you don't start very young, you probably never will. And that should be the focus of our policy. It's clear that despite the industry saying that they're not interested in underage smoking or promoting it, 70% are recruited at an age when they are still minors, and where the legislation of practically most European countries actually prohibits the sale of cigarettes and tobacco products to people of that age. But it still happens. So clearly, yes, there is a lot of new recruitment going on. We then moved on to the next question. What makes a product attractive to young people? It's not just a question of knowledge. The industry will say, you should have more education campaigns. We do a lot of education campaigns, whether it's at national level, at European level, and I will say something more about that later on. But we have to ask ourselves the question, despite the fact that the harm caused by tobacco is very well known, it's very well known. I think there cannot be anyone who says that he or she is not aware of this. We still have a lot of young people smoking. So there must be something in the product that makes smoking attractive to young people. We have had bans, on advertising, yes, and that has helped. But the fact is that the product itself has been turned into a mobile advertisement. This is quite clear also from the industry's own documents. So it is the marketing of the product which is actually now the advert. So we focused on this issue of what makes a product attractive to young people, and two elements came out very strongly from our studies. First, the package and the labeling, the visual element. We live in a very visual society. Our young people, especially maybe even more so than people my age and older, are very much in tune to visual cues. They live in a world, for example, dominated by brands. They are very sensitive to brands. The brand is a story about the product. It's a story about the aspiration of the person who consumes that product. This is the world that young people live in, for better or for worse. And the industry is riding piggyback on that concept. So the issue of packaging and labeling is not just an issue of a normal presentation that every product must have. It's also the way in which you pass on a certain context. Then there is the issue of ingredients. The industry claims that a lot of ingredients are technically necessary, and possibly some are, like in any industrial production of product. But a lot of these ingredients, we don't know exactly what their function is, although I'm sure there is some function somewhere in some industry file. I don't think they add things haphazardly, certainly not. My background is a chemist, so I would understand that ingredients always have a function. But at the same time, it's clear that there's a lot of new branding going on. When we see things like vanilla-flavored cigarettes or pina colada-flavored cigarettes, clearly these products are not designed for hardened 50-year-old smokers. I don't know any 50-year-old smokers going to be enticed by a strawberry-flavored cigarette. These products are clearly designed for young people. So to get them hooked, to reduce the, let's say, initial revulsion, which is the normal defense mechanism that the body has when faced with something like smoke. If this room was full of smoke, the first thing we would do is rush for the door. So the fundamental challenge anybody selling this product has is how to turn around what is a natural human revulsion, which is a very basic instinct, to an attractive issue. So this is a big challenge. So in this respect, I think they have certainly put a lot of effort into that. So what have we done? First of all, with respect to labeling, the Commission has proposed large mandatory picture warnings, which would cover 75% of the front and the back of all tobacco packaging. Now, let me put this into context. What we have at the moment in the Tobacco Products Directive today, we have optional pictorial warnings. So only 10 member states, to my knowledge, 10 member states at the moment have actually introduced pictorial warnings. But the ones that have, the evidence so far shows it has been effective. I can think of, for example, of the figures from countries like Belgium, where this measure has been introduced, and there has been an improvement in smoking rates. And incidentally, there have been none of the very negative effects that the industry claims would happen when you standardize packaging. There has been no, for example, pronounced increase in smuggling rates in Belgium, okay, in this respect. Now, the obvious question is, why didn't you go further? Why didn't you introduce plain packaging? Now, here I have to be a bit more boring and basically talk about the institutional framework. The Commission, of course, has a very specific mandate. It is there to address primarily problems in the internal market. So the basic reason why the Commission can regulate something like tobacco, because let's not forget, under the treaty, health is left to the member states to regulate. And that's a good thing, because there are many specificities in health systems and health needs. But when you have products which travel across borders, there is also an internal market issue. Now, the Commission has the prerogative and the right and the obligation, some would say, to harmonize the internal market when there is a clear discrepancy in how member states are acting. The Commission, therefore, could not propose plain packaging as such, because so far no member state, Ireland is the first example now, actually no member state so far has implemented plain packaging. So we could hardly harmonize that. But we could, and we felt we should, harmonize the fact that some member states have taken up pictorial warnings and others have not. We believe the next logical step is to have mandatory pictorial warnings, the larger the better. And we went for 75%. 75% front and back is a political decision, but it was designed also to go for a figure which we felt would attract the biggest possible consensus among the member states. But the Commission also made it very clear, and I would like to emphasize this is a red line for the Commission in the negotiations. Member states must be free to go further if they so wish. So we found a formula that would legally allow member states to go for full plain packaging if they so wish, because we are harmonizing part of the packet, not all of it. And member states are free to regulate the rest. And I would like to emphasize this will be a red line for the Commission in the negotiations. We will not accept any reduction of the right of member states to go further if their health situation requires this, or if their tobacco control policy requires this. The reasoning behind what the Commission is proposing, we want to make sure that packages must effectively display health warnings. Today we have, as a minimum, text warnings. These text warnings are often placed in ways, but together with other visual or other messages which obscure or which minimize the impact. Very often, even today, despite the fact we have text warnings, if you see a packet of cigarettes, the first thing you notice is certainly not the warning, but it's the pretty picture on the front. So clearly that is something we need to correct. The warning should be the first thing you see. And we also felt we should regulate other aspects, other visual aspects, the shape of packages. We now see, for example, targeting the female market, products which are designed to look like cosmetic packs. So really, first of all, they create a practical problem. Something which is shaped like a lipstick container. Clearly, the picture element, the proportions are simply not there. But also, it's designed to give a different visual cue in the mind of the potential consumer. So clearly, we felt we should regulate shapes as well, and these kind of shapes should be removed from the market. Then we focused also on the cigarette itself. We also proposed a ban on slim cigarettes. To my knowledge, this is the first time this has been done in the world. Slim cigarettes are being banned. And there is a good reason for this. We have ample evidence that slim cigarettes are marketed mainly to young women, have the potential to mislead consumers, and present them with an erroneous comfort about the risk of smoking. I have seen studies which show that people think that slim cigarettes are safer. No logical reason for this, but this is the perception. And perception is often more dangerous even than reality. Slim cigarettes, other studies have shown, are also associated with femininity, elegance, weight loss. So clearly playing upon some very important issues in the mind of a typical 16, 17-year-old. So this is something we want to address. Now, a big argument made by the industry and its allies is that you are interfering in people's lives. This is the nanny state gone mad. I've heard all of these. This is basically people's right to make a choice. We agree with choices, but choices have to be informed. this is not a packet of crisps we're talking about. This is something which is addictive. No? So if there ever is a choice, it is only free for the first few cigarettes you smoke. From there onwards, it is no longer free, it is an addiction. And addiction is the denial of free choice. It is the opposite of free choice. So the aim should be that when you look at a packet of cigarettes, particularly young people who still are in a position to exercise a free choice, you should get a clear and unambiguous message that the product will damage your health. This is the first message you should get. Then make your choice. But you should know what you're getting into. And that is not easy to get out of this. It's not like buying a food product. Even there you have sometimes problems of indirect addiction. This is a product which is directly addictive. And it's one of the most powerful addictive substances we know. It's more addictive than some substances which are illegal. So we need to recognize this fact. Ingredients. It's not just the package. It's also what's in the product. As I mentioned, these strong flavors, vanilla, menthol, others, clearly are designed to make the product more palatable and therefore more acceptable. We are proposing a complete ban on characterizing flavors because we believe, as our commissioner says, tobacco should look and taste like tobacco. It should not look or taste like any other item, certainly not like a food or sweets or something which is attractive. There should be no confusing of the message. The message should be clear. This is a product which is dangerous. It is only on the market for historical reasons. If it were a new product today, I think we would be rushing over ourselves to get it banned. But it is a historical product. The aim is to gradually reduce and continue to reduce consumption as low as possible. But in the meantime, we have to make sure that people are not tricked. We also included a number of other issues which are not maybe always directly relevant to the issue of attractiveness, but also we felt were in need of an update. There are measures on illicit trade. We want to introduce tracking and tracing, mandatory, not based on voluntary agreements or whatever with the industry, but mandatory legal requirements that can be enforced by the member states. Also, that would measures that would allow consumers to be more aware of the fact that you have on the market products which are counterfeit, contraband, illicit. So also both visible and invisible measures. We want to have stricter rules to regulate internet sales of tobacco products. A lot of the cross-border internet sales which happens is not legal. But we believe that even in those rare instances where it is done in a legal way, the member states should be in a position to regulate. So we will introduce a notification requirement both in the country where the seller is based, but also in the member state where the products are going to be received. And this would then help the member states to properly enforce the legislation. We will be maintaining the ban on oral tobacco, including snus. That's very clear. And we also felt we should regulate electronic cigarettes. And please allow me to say a few words on this, because this is, I know, a key issue. I've spoken recently to the rapporteur in the European Parliament. Now, the European Parliament has been bombarded with amendments on electronic cigarettes, especially in countries like the UK. And of course, again, it's the usual criticism, the Commission going wild, trying to ban things which are useful in the fight against addiction, and so on. Well, let me say a few things. First of all, the Commission does not propose to ban electronic cigarettes. There is no ban on the table. We are proposing regulation of electronic cigarettes. The industry itself has admitted that at the moment, the only thing they are covered by is the General Product Safety Directive. Now, the General Product Safety Directive is fine for a shirt or a tie. It's not designed for something you inhale. So that's the first thing. Do we want to have a product which goes straight into the lungs, and when a substance goes into the lungs, it's equivalent in medical terms to injecting the substance. It goes quickly into the bloodstream. So do we want to leave this unregulated? So we want not to ban, but we want to regulate. Secondly, we need to establish the evidence. The evidence that these products are useful in the fight against tobacco is still not unequivocal. We need to study this aspect more. Are these products just a fad, or are they potentially useful? But to be useful, if they are
useful at all, they need to be regulated. If these products are to develop a marketing potential, they should develop their cessation potential. We want the industry to make a clear choice, whoever is behind the marketing of these products. We are not interested in promoting addiction. We are not interested in promoting marketing fads. We are interested, if the potential is proven, to see these products develop as part of a nicotine control policy, a harm reduction policy. But for that we need the evidence, and we need a strong commitment by the companies behind these products that they are willing to invest in research and evidence and in accepting proper regulation to make sure that these products can find their rightful role in providing an alternative to people who are maybe so addicted that they can't immediately quit. And of course, we believe that to have good regulation, you need a good legal framework. We think that in the current system and what is realistically possible, the best possible legal framework for harm reduction is the existing medicinal products legislation, for a number of reasons. The medicinal products legislation offers adequate guarantees of quality, efficacy, and safety. There are those who say by requiring product as to be regulated as a medicinal, you are effectively banning it, because there is this impression that medicinal products legislation is only for the big companies. You need massive dossiers costing millions. Well, most medicines are produced for markets which are far smaller. The number of patients for most diseases is far smaller than the number of people addicted to tobacco. That's the first point. It's not true that medicinal products are only developed by large companies. You have a lot of SMEs in the medicinal products area, very successful. The issue is you need to have a company that is structured in a way which is in line with the medicinal products legislation. So there is a structure for quality assurance, for good manufacturing practice, a culture of responsibility in the company. And even if it's a small company, if it's a medicinal company, it will have these characteristics. And why should we not have the evidence? If these products, my challenge to the electronic cigarette industry has always been, if you are so convinced that these products can actually help people deal with their addiction, then you should not have a problem, because you can put all this in a file. So this is the challenge and we would like to see these products develop their full potential. And I would like to repeat, we are not banning these products, but we do want to regulate them. Now, to conclude, let me say, it's not just our efforts on tobacco. Of course, the Tobacco Products Directive at the moment is under negotiation in Council and Parliament. And here I would definitely like to pay tribute to the strong leadership shown by the Irish presidency, who has not only taken on the work carried out by the previous presidencies, and they also thank them for that, but I think has brought a new momentum into this very difficult, very politically charged, and also because of developments you are very aware of, it became even more politically charged. But I think the Irish presidency has shown very good leadership on this, so I would like to pay tribute to that. Also to pay tribute to the excellent work being carried out in the European Parliament. I know it's not easy, it's a very complex topic. The Commission has put on the table a proposal which deals with a lot of issues, and clearly, my understanding is that there will be around 2,000 amendments so clearly, a lot of those amendments are obstructionist. They are designed, to create problems. This is the usual. We will find a way to deal with that. But there are also some amendments which are probably, genuinely motivated, desire to seek improvements, and we want to work together with MEPs who share our intentions to try and improve the legislation wherever possible. To conclude, it's very important that this directive is adopted by the end of this year, or at least we reach a point of no return before the end of this year, because the European Parliament reaches the end of its mandate next year. We will have fresh elections. We could be faced with a very different Parliament. If the proposal has not reached a certain stage, we are back to square one. Obviously, there are those who would not be displeased with this outcome, but I think all of us who want to have improvement in tobacco control, we want to do everything we can to avoid this kind of situation. So clearly, I think here we should all intensify our efforts. I would like to say that what the Commission does on the Tobacco Products Directive is not limited to just legislation. Awareness campaigns that are also an important part of the Commission's tobacco control policy. Yes, we also do education and information, but it's not an either-or. Legislation and information are complementary and should be complementary. In June 2011, the European Commission launched a 3-year awareness-raising campaign, I'm sure you're all aware of, entitled Ex-Smokers Are Unstoppable. And this campaign focuses on the physical, personal, and even financial benefits of quitting smoking. We wanted to send a positive message in these very difficult times. So it's not, certainly, the facts are facts. We cannot deny that smoking kills in a very terrible way. But also, especially when talking to young people for whom these problems might be, decades away, we also wanted to give a positive message. Be more in control of your own life. Don't let this addiction take over your life. No. And this is a message which has resonated very well. We have tried to be practical also in our campaign, so not just providing information, but also providing practical help. We launched the online aid, the so-called iCoach, which is a free digital health coaching platform available in all official EU languages. And I'm pleased to say that since its launch, almost 400,000 people have signed up to iCoach. The campaign has reached almost 350 million Europeans so far through promotion in print, digital and social media. And nearly 40% of these 400,000 iCoach users describe themselves as ex-smokers after 3 months. So clearly, we feel that this is taxpayers' money very well spent. And I would like to thank all those who have worked with us to contributed to this big success. So let me conclude by encouraging everyone, all of you, to continue to work together, to persevere, to promote cancer prevention in the EU, and also specifically our work on tobacco control. This requires a very good coordination between what is happening in Europe, what is happening at national level, what is happening at regional level. There are some new challenges like the ones you mentioned. The Commission is very concerned, for example, about the growing social divide in Europe. This is something where we will be intensifying our efforts, particularly as it becomes obvious that this crisis is not a short crisis, it is a long structural crisis. And therefore we need to pay particular attention to those categories of society that are taking a disproportionate hit in terms of their prospects. Also keeping in mind that we need to place the European population, which is our only fundamental resource in Europe. If there is a hope for the recovery, it has to be in our human capital. And we should place our population in a position to benefit from the recovery. Hopefully it comes sooner than later, but we should avoid having too many people unable to participate and benefit from the recovery. So thank you very much, and I greatly appreciate this.